Hi, I'm Dr. Lakshmi Kandamneni. I'm the consultant plastic, cosmetic and reconstructive surgeon at Pace Hospitals, High-Tech City, Hyderabad. In this video, I would like to answer the frequently asked questions about hair transplantation procedure. It is a surgical procedure in which the hair follicles are transferred from one area, which is called donor area, to a bald area or alopecia area called the recipient area. This is usually done in case of male pattern baldness or androgenic alopecia. In females, we also see female pattern baldness similar to the males. Apart from these two, the other place where hair transplantation is required is in case of scar alopecia, or in case of beard hair transplantation, or mustache hair transplantation, or in case of any other areas which requires concealing of scars with the hair. So these are the commonly done procedures or indications for hair transplantation procedure. Commonly there are two main procedures called FUT and the second one is FUE. In FUT, which is also called follicular unit transplantation, a strip of hair bearing scalp is removed and the strip of hair bearing follicles are separated and each follicular unit or the units of hair bearing scalp are transplanted into the recipient area. And the second procedure is FUE, which is called follicular unit extraction. In this procedure, with a mini punches, we remove each hair follicle and then these will be transplanted to the recipient site. Major difference between FUT and FUE is that FUT will give you a long linear scar and FUE will have small puncture marks where the hair follicles are extracted. And apart from this, FUT procedure, we don't need to shave the hair because the scar can be hidden in the between the hairs, like above the scar, the hairs which are grown will try to cover the scar area. In FUE, the whole head might need shavings because it is done in a very diverse area where micro punches are taken. So apart from these two differences, rest of the things are almost similar, but FUE will have less graft loss compared to FUE technique. So after coming for a diagnosis about the alopecia or the grade of baldness, we usually give the patient the options for hair transplantation procedure. Usually, we always advise the patient to go through necessary blood tests so that they are fit for the surgery. And then we will advise them to plan for surgery. On the day of surgery, we will wash the scalp thoroughly and then zero trim that area if they are going FUE technique, and only in the scar area if they are undergoing FUT technique. After proper preparation of the area and proper washing with antiseptic solution, local anesthesia with or without sedation will be given so that patient does not have any pain, and then extraction of the hair follicles are done. After extraction, these follicles are stored in a cold chain so that the follicles are maintaining, and these when transplanted, the survival rate will be better. After the extraction process is over, the implantation will be done by using either slit method or direct needle method or implanters method. And the hairline, if the patient is planning for hairline, and we will ask the patient how they prefer their hairline, and also we will advise how their hairline will look after the procedure. So usually we do hairline first and then go to the vertex area or crown area. And apart from the scalp, the other areas like mustache, beard and scar areas, depending upon the density required, we will advise the number of hair follicles per square centimeter in that area. And the patient, after the procedure, they can go back to home on the same day, since it's a daycare procedure, and they will need to take some medication like antibiotics and painkillers, and they will be having dressing at least for 1 to 2 days after the surgery. They can resume their daily activities and all after a day or two. Apart from that, physical activity, swimming, like jogging and all, can be resumed after 2 weeks after graft settles in the recipient area. Who is not eligible for hair transplantation procedure? Any person who has bleeding disorders or autoimmune diseases or any infections, active infections of the scalp, or any dermatological conditions like pemphigus and scarring like hypertrophic scars and keloids, we advise them not to undergo, because they will have problems either during the procedure or after the procedure. So these are the patients who are contraindicated for hair transplantation procedure. So when done in a proper setup, in a hospital setup where all the aseptic conditions are maintained, where the cold chain is maintained and proper handling of the grafts are done, there won't be any risk involved during the procedure or after the procedure. But these days commonly people are getting it done in a salon. So in those conditions, they can have the risk of scalp infection, cellulitis and some allergic reactions associated with local anesthesia, and very rarely we can also see mortality if they are done in conditions which are not favorable for surgery. So we always advise our patients to get these kind of procedures in a proper accredited hospital or a proper setup where all the facilities are available. Yes, it is a permanent procedure because the hair follicles are taken from the same patient and transferred to the bald area or alopecia area. Since it is done from one patient, from the same patient, the transplanted hair follicles will always behave like a normal hair, except they are placed in a new area. So of course it is a permanent procedure and the transplanted hair will grow like a new hair. Yes, it is a safe procedure. Very rarely we can come across complications like bleeding, infection, and very few patients will have allergy to the local anesthesia. So we always have some emergency drugs in case they have any reaction to the local anesthesia. So you don't need to worry about this, and we can assure you that it's a very safe procedure. Usually we give local anesthesia for the procedure. Sometimes in case of apprehensive or anxious patients, we also give sedation apart from local anesthesia so that they won't be any anxious before the procedure or during the procedure. So throughout the procedure, the local anesthesia in small doses will be given, and the procedure will be totally pain-free. So it is not a painful process at all. Of course not, because it's just transferring the hair follicles from one area called donor area to a recipient area, and of course it doesn't cause any cancer because it is done in the same patient, and there won't be any gene mutations or anything of that sort associated with it. How long does numbness last after hair transplantation procedure? Usually it will last for few hours after the procedure, and mostly the patients will have some heaviness of the head. They don't feel any pain after the procedure. Mostly it will be some heaviness after the procedure. It is usually rare because we always check the patient's bleeding time, clotting time before going ahead with the procedure. And also after the procedure, we put a dressing so that even the small puncture points and all won't bleed. So it is unlikely for any patient to bleed after the procedure. When does hair shedding start after hair transplantation procedure? Usually when the grafts are transplanted into the recipient area, the grafts will undergo a process of shock. So whatever the transplanted follicles are there, they try to survive, but the hair shafts fall off. So even if the hair shafts fall off, a new hair tries to grow. So usually after 2 weeks or so, these hair shafts fall and the new hair tries to grow. How much time does it take a transplanted hair to grow? After transplantation, usually it will take around 6 to 9 months for a new hair to grow, and for attaining a proper length it will take further long. So you can see the results after hair transplantation procedure after 6 to 9 months. So you can usually expect after 9 months. What happens to the donor area after hair transplantation procedure? So in case of FUT, the donor area is always hidden because the hair above the scar will be long enough so that it covers the scar area. In case of FUE, small puncture marks are there which will be covered with the surrounding naturally growing hair. So these scars won't be seen, and mostly these will be in a hidden area. Is PRP necessary after hair transplantation procedure? I would say yes, because whatever the hair transplanted can have a shock phase. So to decrease that shock phase and also to improve the donor area where the hair grafts are taken, the surrounding hair follicles also can get affected. So to prevent that hair loss in the donor area also, this PRP works well. So we advise our patients to take PRP after hair transplantation procedure for at least 3 to 4 sessions, and it is up to them to continue after that. Is hair transplantation procedure safe for diabetics? Yes, of course, it's a safe procedure when they have the sugars under control. We usually see the HbA1c level prior to surgery and try to keep their sugars under control during the pre-operative phase, intraoperative phase and post-operative phase. The only thing they can have is the higher risk of infection apart from the normal patients. So we always try to keep the sugars under control during the perioperative period, and these people also can get the hair transplantation done like normal people. What is the success rate of hair transplantation procedure? So usually it ranges from 90 to 95%. When the grafts are stored in proper cold chain and the handling of the grafts are done well in experienced hands and all, it will be more than 90%. So in case of improper setups where in saloons and all, if they don't maintain cold chain and all, you always come across this graft loss after hair transplantation procedure. That is because they did not maintain the grafts, or handling of the grafts are improper. How many times can we do the hair transplantation procedure? So it is up to the donor area. If you have enough donor area, you can do twice, thrice, and multiple times also. If the scalp hair is not enough, sometimes we take from beard, sometimes from body hair also. So it is up to one's own donor hair capacity. So the number of procedures doesn't matter actually. What precautions should be taken after hair transplantation procedure? Usually we advise the patient to lie down with at least 2-3 pillows under the head, so that head is always elevated and compared to the body, and the swelling and the edema will reduce faster after the procedure. That is one. Apart from that, we advise the patient not to touch that area often, and for at least 2 weeks, we will advise them to avoid doing hot showers or swimming or doing intense activity where there will be too much of sweating. So these should be avoided at least 2 weeks after the procedure. And after 2 weeks, when the grafts settle well and all, everything can be resumed. So these are the only things which you need to be aware of after undergoing hair transplantation procedure. And apart from this, we always give medication like antibiotics and analgesics to prevent the infection after the surgery also. Which is better, PRP or hair transplantation procedure? So PRP is like a temporary solution for any active hair loss or any stress related hair loss and all. But hair transplantation is like more of a permanent procedure rather than a temporary one, because the results of hair transplantation are like permanent, and the transplanted hair will grow back like a normal hair. And the PRP, it as I said, it's a temporary one. It only halts the hair shedding process, or in other terms, like the telogen phase and all will be decreased by the PRP. So I hope you understood this, and I hope I have answered all your queries regarding the hair transplantation procedure. And for more information, you can get back to us or consult us. Thank you.